Actions being taken to fight COVID-19 here in Hawaii. I will be introducing the speakers, and please do as far as possible. You need to move out, move away, and with we are implementing the social distancing measures here, so please respect that. Thank you, Governor.
First of all, I really wanted to thank the people of Hawaii, businesses large and small, for answering the call last Tuesday to really implement the actions that we need to take as a community to fight the COVID-19 virus. It is obvious that overwhelmingly the community has come together and taken responsibility for keeping each of us healthy and safe here in Hawaii. I would like to provide an update of where we are regarding testing and the outcome so far. You know, we have been aggressive in establishing testing centers all across the state. There are more than 42 in operation as we speak. More than 2,500 tests have been completed in the state of Hawaii so far. 2,200 of them have been completed by private labs. And this includes our Community Sentinel testing program. All of the Community Sentinel tests, 263, have been negative. There has been no evidence of COVID-19 in the broader community. We did receive 11 new tests that were positive in the last day, 7 on Oahu, 2 on Hawaii Island, and 2 on Maui. As we all know, the threat of COVID-19 is extremely serious and it requires extreme actions. Today, I signed a second emergency proclamation, an order mandating 14-day quarantine for everyone who will be arriving into our state, both visitors and returning residents. This mandate is the first of its kind in the nation. I've worked on this plan with our mayors and our industry partners, and I really want to thank them for their commitment to their employees, for their commitment to our community, and most importantly, for their commitment to keeping our community safe. I want to thank them in every way. They were selflessly thoughtful of the actions that we needed to take as a community to cope with COVID-19. This mandate will go into effect Thursday, March 26th at 12:01 a.m. and will be in effect until further notice. We want this action to send a message to visitors and residents alike that we appreciate their love for Hawaii, but at this time, we believe that our community is very, very important, and we need to come together as a community to fight this virus. We are asking them to postpone their visits to our island community. We know that our economy will suffer from this action, but we as a community, and again, I truly appreciate the cooperation that we've received from our hospitality industry to understand that these actions are necessary. We believe that it will help us to flatten the curve so that our healthcare system is not overwhelmed like it has been in other communities around the world. We need everyone to comply with these quarantine orders because the safety and welfare of the people of Hawaii is our #1 priority. I really want to thank you for joining us here for this important announcement.
Our next speaker is Kenneth S. Hara, Director, Hawaii Emergency Management Agency.
Good afternoon and aloha. Currently, all of the positive COVID cases have been linked to travel or contact with a traveler. And that's why we believe these quarantine measures are important to further mitigate the spread of the virus and prevent it from being imported into the state. All visitors that arrive in Hawaii will be handed out the agriculture form and will be mandated to fill that form out. They'll retain that form, and as they exit the airplane, they'll proceed to a checkpoint. Personnel at the checkpoint will verify their identification, ensuring that everything on the form is accurate, which includes where they'll be staying and their phone number. We'll collect those forms and collect the information. So if you're a Hawaii resident, your designated quarantine location will be your place of residence. If you're a visitor, your designated quarantine location would be your hotel or rented lodging. You may leave your designated quarantine location for medical emergencies or to seek medical care. If the traveler becomes ill with a fever or cough, they are to continue to stay in the designated quarantine location and avoid contact with others. Contact the healthcare provider for further instructions or treatment or testing. If you need medical care, contact your healthcare provider and inform them of your travel history. And for urgent medical care, for example, difficulty breathing, call 911 and let the dispatcher know of your travel history. Failure to follow this order is a misdemeanor punishable by a maximum fine of $5,000 and 1 year imprisonment. Enforcement will be handled by the 4 Hawaii counties. Lastly, the Hawaii Department of Education will follow up separately on school and school-related impacts. Thank you.
Our next speaker is Mayor Kirk Caldwell, City and County of Honolulu.
Good afternoon and aloha. I want to emphasize that we all stand here today united with Governor Ige and his recommendation on quarantine for all people entering the state of Hawaii, both visitors and residents. Yesterday afternoon, the mayors of all the counties, along with the governor and other people, had a long and vigorous discussion about how to proceed with the next level of responding to the COVID-19 pandemic. And we were united in taking action. Sometimes there's a difference in some of the details, but at the end of the day, it's about standing up together and supporting and protecting the people of the state of Hawaii in every one of our counties. And today, with the governor's announcement, he is taking those next steps, and we stand with him. We want to thank our partners in the private sector, both in the airline industry, the visitor industry. These are the most difficult times I believe the state of Hawaii, the territory of Hawaii, the Republic of Hawaii, or the Kingdom of Hawaii has ever faced. And I think the response is appropriate, and we stand together. Thank you very much.
Our next speaker will be Peter Ingram, President and CEO of Hawaiian Airlines.
Hawaiian Airlines has been flying between the islands of Hawaii for 90 years and been flying beyond it for 60 years. It is our home, and we deeply care for it. I know I speak for every single one of our 7,500 employees when I thank the first responders and medical professionals in Hawaii who are fighting this disease. Governor Ige, thank you for working with us and other members of the airline and hospitality industry to make sure we can make the necessary adjustments in an orderly fashion. Our responsibility to our guests is to make sure we get them back home. This includes both guests who are here now and residents who are traveling and want to return to Hawaii. We understand that this action is motivated by a desire to restrict travel to and from our state. We anticipate adjusting our domestic and international flying schedules to a bare bones level after Wednesday. Hawaii Flies With Us isn't just a motto. We provide essential services on neighbor island routes such as moving blood for the blood bank, transporting doctors and patients, stevedores, and utility workers. We will keep a neighbor island schedule operating, but it will be at a much more limited than our typical 180 flights per day. I also want to recognize the men and women on our front lines, our pilots, flight attendants, and airport personnel who have continued to serve our guests with hospitality during these very difficult times. I join the governor and every one of my colleagues here in the hope that Hawaii can contain this illness quickly. We stand ready to support this effort.
The next speaker will be Elliot Mills, Vice President Hotel Operations for Disneyland Resort and Aulani.
Hello and good afternoon. Similar to the mayor, we met with my colleagues and the governor yesterday to discuss the options at hand, and I want to thank the governor for taking those very bold actions. I think it is in alignment with our priorities in putting the safety and the welfare of our cast members, our employees first, as well as our community. And I think it's also important that we take this bold step now so that we can continue to operate in good order, get our guests home safely, and also, hopefully, very soon bring our guests back to this state and to enjoy our islands. So I thank the governor again, and we look forward to welcoming our guests back soon. Thank you very much, and mahalo.
The next speaker is Eric Gill, Financial Secretary and Treasurer, Unite Here Local 5.
Aloha. We have thousands of members laid off and unable to work right now. They're concerned that their medical coverage be continued, and they're also concerned that they be able to retain their homes and their cars and everything that they built. Their dreams are being clouded, and it is important that as a community we take any necessary action to keep this thing under control so we can get past it and so our members can get back to work and get back to having a life. We have to attend to the healthcare aspects because people are scared. We have to attend to the economic aspects because people are worried. And we have to also attend to the needs of our healthcare providers. We represent a couple thousand people in the Kaiser system. They are struggling to make sure that they have sufficient masks, gowns, and protective equipment so that they can protect the rest of us. And we need to ensure that they are themselves protected and not infected by the disease they're protecting the rest of us from. We support this action. We will support stringent actions to make sure that this thing is short and that we are able to emerge from it as a valuable destination. And we believe also that our employers are going to need the support because many of our employers are also under duress with zero income, and we have to have jobs to go back to when this thing is over. Thank you, Governor, for your action. We anticipate more actions may be needed. We will support that. Let's cap this thing, move on, and get our jobs back. Thank you.
The final speaker today is Mufi Hanneman, President and CEO of the Hawaii Lodging and Tourism Association.
Hello, my kaku. Good afternoon, everyone. Aloha. We in the hospitality industry stand behind Governor Ige's actions. We know that the longer we delay taking these bold initiatives, the more we're going to have to pay in human suffering, possibly human lives, and certainly from the economic downturn that will continue. We appreciate the governor reaching out to us. We had a very robust discussion in being able to share our mana'o with him and the continued commitment that he has. We want to be clear. This is all about public health and safety. And to echo some of the remarks that we said before, we are very concerned about the impact it will have economically on our families, our working people, our employees, our businesses. The governor has given us his commitment, and we will work with him to ensure that we can bring relief both short-term and long-term in a true collaborative partnership to meet these needs. So, Governor, again, thank you very much for bringing us together. We're united, we stand together, and eventually we will make it through. I believe that. But we need to continue the spirit of cooperation. Mahalo.
So for our media Q&A today, there's a lot of people here, and we need to do it just a little bit differently. So if you don't mind, if you have a question, raise your hand, you'll be recognized. But please tell us whom you would like to speak with. Again, this is to avoid the cluster around the lectern. So Ben, you have your first question.
Governor Ige, why Thursday and not immediately?
So the question for those who didn't hear is why Thursday and not immediately?
Certainly, we, in working with the industry partners, we do know that 14-day mandatory quarantine is an extreme action. We do want those who may have scheduled trips to the islands to have the opportunity, and we hope take the action to cancel or reschedule their trip so that they are not here and then suddenly subject to being in their room for 14 days. So the delay is really in order to allow our industry partners to make adjustments as appropriate so that we don't have someone come here and be surprised that they would be quarantined for 14 days.
For Governor Ige. Governor Ige, how are you going to enforce this if people are at a hotel?
So just for those who didn't hear, the question is how is this going to be enforced?
You know, we have had conversations with the county mayors, and the county mayors would be enforcing the actions in each county. You know, obviously, there's lots of things that are required, and the mayors are dealing with a lot of different activities. You know, we're all prioritizing, deciding which things are most important, and certainly acting appropriately.
How will this apply to airline employees, like flight attendants, pilots?
Sorry, who's your question for?
Oh, for Governor Ige.
For Governor, and what was it?
How is this going to apply, the quarantine going to apply for pilots and flight attendants and those who work in the
So
airline?
the question is how does this quarantine mandate apply to flight crews?
Yes, the quarantine mandate does not apply to flight crews and pilots.
Next, Jen.
How will this work if someone does decide to still come to Hawaii and their stay wasn't supposed to be 14 days? Will they then be allowed to leave? And if they can't afford to stay, then what happens?
So the question is, what happens if someone has a trip scheduled for less than 14 days? The quarantine is in place for the duration of the trip. If they are here for 5 days, then there is a mandatory quarantine for 5 days. The traveler is fully responsible for the cost of the quarantine.
Tim, you had a question?
How tough are you going to be on enforcing this?
The question is how tough is the state going to be on enforcing this mandate?
You know, as I said, we're working with the counties for enforcement, but there is lots of things that we're doing, and so it would vary from county to county about what enforcement action would be required. All the mayors, just as I as governor, are looking at all the actions that we need to take and applying resources in the places that they are most necessary. So, you know, we definitely believe that everyone arriving will get a copy of the quarantine order and will be clearly understood what they would be required to do and what the penalties would be.
Marcel, go ahead. Who is this for?
This is for the governor, but Peter might be able to assist.
Governor and maybe Peter. Okay.
My question is approximately how many passengers arrive by air every day in the state? And second to that, how many have you guys projected about how much of a dip you're going to see in that with this action?
So 2 questions. How many passengers per day, and is there a dip is projected?
Let me just say this. You know, when I asked our visitors to postpone their vacations for 30 days. We saw a significant drop in all airlines coming to the islands. More than 50% of reduction in the traffic coming to the islands. I think Peter can talk a little bit about what they anticipate would happen from their airlines. I know that there are other airline representatives. We know that this will significantly impact the number of visitors.
The number of visitors to Hawaii in 2019 was about 10 million visitors. So you can do the math on what that is on a daily basis. Right now, our daily passenger loads are far lower than that. Typically, our flights from the Western U.S. would, which is the largest visitor market by far, would have load factors of about 90%, so 90% of the seats on every flight full. In recent days, those have been running in the 40s and 50s. We saw a fairly dramatic drop in advance bookings as the news flow around the country has accelerated in recent weeks, and in particular with the governor's announcement earlier this week to dissuade people from visiting the islands. We've seen load factors drop even further, so into the 30s looking forward into next week. So the number of people affected today is a lot lower than it would be if we were in normal circumstances. Similarly, from Japan, the largest international market we serve, where there are about 1.5 million visitors come every year. That is, our flights from Japan are typically north of 90% full. Those loads have dropped consistently, and as we look forward over the next couple of weeks, they've dropped really into the 20s in some cases. So there's already been a significant impact on demand. I suspect that most people, when they become aware of this news, they are going to choose to postpone their vacation to Hawaii. I don't think there's much appetite for 14 days in a hotel. As much as people like visiting a hotel, they come to Hawaii to sleep in the hotel and spend a lot of their time out of their room.
We have, so I'm going to see if I can get this right. KITV, sorry, Director Hara needs to step in for just a second. Then we'll go to KITV.
So the direct answer to your question, the tourists arriving here dropped by 67% overall after Governor Ige made his announcement. 75% of that were international travel. So if you go to the Department of Business, Economic Development and Tourism, they have a website and a link, and you can actually see the figures on a chart. So DBID. Thank you.
Now we'll go to KITV. Who's your question for, please?
Governor Ige. Governor, with a portion of our healthcare population being transient, such as traveling nurses, will they still be allowed to come in and get to work, or will they have to quarantine for 14 days?
So the question is about transient healthcare workers such as traveling nurses. Would they be subject to the quarantine?
The Director of Hawaii Emergency Management will have the authority to grant exemptions to the quarantine as appropriate. As you know, we are the most isolated community on the planet, and we constantly have critical things, blood, supplies that travel back and forth between here and the mainland. So clearly the director would have the authority to grant exemptions that are appropriate.
So they would be quarantined until?
No, I mean, we would take up those issues and identify those that need to be excluded from the quarantine as appropriate.
Okay. Ben was next, please, Ben.
Okay, this will be for Governor. Now, there are some lawmakers, the House Speaker, and others who've been saying that the state should follow the lead of California, New York, and other states that have had a complete shutdown or having people stay in their homes. Why not take this action?
So the question is, why not completely shut down the state such as others have done?
Certainly all measures are on the table. Mandatory staying in your homes is an extreme measure. that we may implement here, but it really is appropriate when there is widespread community spread of the virus. So we are working and looking at all of those. I would like to remind everyone that it's in our best interest that we voluntarily self-isolate right now. We can do that. We all need to take the action that we have within our powers to self-isolate, to stop the interaction that could spread the virus more rapidly.
Jen?
For Governor Ige, will there be shuttles or buses to get those visitors from the airport, or will they be left on their own to possibly infect others en route?
So the question is about visitors who are coming into the airport. How would they be getting from the airport to their quarters?
You know, the visitor is responsible for transportation and getting to their place of quarantine.
Ashley? Okay, Mayor?
Mayors are in charge of enforcement. Can you kind of go into a little more detail on what that would mean for Honolulu as your only mayor right here?
Okay, sorry.
And then also, can you explain specifically how you're going to keep track of who's coming in from the airport?
Okay, so that might be a different, that might be Director Har, but we'll start with Mayor Caldwell. The question is about how are you going to enforce? And the second question for Director Har would be how are you going to keep track of people? I think that's for you.
So, number one, the action taken by Governor Ige is an extraordinary one, the first in the nation. What he's telling the world is that anyone coming into Hawaii has to quarantine. If you're a visitor, you got to quarantine in your hotel. If you're a local person coming home from school, you got to quarantine at home. But it's across the board, everyone coming into Hawaii has to quarantine. I believe because of this announcement and giving enough time, you're going to see very few, if any, visitors in Hawaii. That breaks all of our hearts. So when you ask about enforcement of visitors who are going to come in and stay at hotels, I have to ask myself, who is going to come to Hawaii on Thursday and self-quarantine in their room for the rest of their trip? So the question you're asking is one I hope we don't have to actually ever implement in terms of enforcement. But should we be called by a visitor who does come, by hotel management that says we have someone who's not cooperating or complying, we will take the appropriate action, which is a misdemeanor and a fine. But I don't think a visitor is going to appreciate having a police officer approaching them about not complying with an extraordinary measure by the governor of the state of Hawaii. So I hope we're never going to have to address that issue. You know, yesterday we were being sent pictures as the sun was setting in Waikiki by visitors in Kohio Beach, practicing no social distancing whatsoever. Shoulder to shoulder, sitting down with each other along the wall, maybe transmitting the virus, and then infecting those who are from here, the hotel industry, people who are serving them and cleaning their rooms, and we do not want that. The governor is taking action to protect the people who live here. And I hope that everyone complies and visitors do not come here after Thursday.
For residents, how that would apply as well? Like how the enforcement would work?
So the question is also about residents, and we still need to get to Director Har as well.
So I believe again that most of the residents of our community for the city and county of Honolulu, the island of Oahu, will comply. Because we're a place of much aloha, ohana, making sure that we don't hurt and infect our neighbors or other loved ones and coworkers. So I think there will be compliance. Now, we may have situations with certain people, and if that happens again, the police will step up to take action where need be. But I think they're going to be few and far between. Okay? You had something on.
Yeah, Director Har, you want to, the question is about how are we going to keep track of folks?
So as I mentioned in my statement, we're going to collect the data of all the visitors to the islands. And what I forgot to mention, these are for all modes of travel, right? Not just air. So we're going to use the agricultural form, which has the name, which hotel or where are they lodging at, and a phone number. So that's the first thing. We're going to collect all of that data and put it in a report. Also, you know, we're going to seek the assistance of the hotels to let us know if there's any non-compliance. To date, we have not had any issues with anyone that was asked to self-quarantine. When the Department of Health went to monitor, everyone was in compliance. So as Mayor Caldwell said, we want the people of Hawaii to continue that, right? The aloha spirit. Let's not infect anyone else from our beautiful state. So we believe most people will comply. Thank you.
And Jen, and then Marcel. Jen.
Is any action going to be taken against tour companies who, for example, tour buses are continuing to drop off loads of tourists at beaches and places that are closed, like Kualoa Ranch? Is any action going to be taken against those companies? Are they going to be forced to shut down?
So the question is about visitor activities and tours, and would they be forced to shut down?
So we are working with our industry partners. Obviously, this order will dramatically reduce the people coming to Hawaii. There is no doubt in anyone's mind. The industry knows that they will be impacted, and the industry is taking appropriate steps to stop buses and tours because it doesn't make any sense to keep them open.
Marcel.
For the governor, among you and your staff, have you discussed any sort of time estimate of about how long you think this measure will be necessary?
No, we've, as you know, we are monitoring the test results continuously, and we evaluate options several times a day. So we know that this is, there is no other time in history of the planet where this has occurred. It is impacting every single industry in our community, unlike it has ever happened before. So I think the best thing we can do as a community is recognize that we have to work together. And I'm proud to be governor of the state of Hawaii because no one knows how to do that better than all of us here in the islands.
Okay. So I think I lost track of you. But Jen, did you have one?
I do have a question.
And then Ben, you'll be next.
What about the visitors who are already here in the islands? And two, is the state prepared for a possible influx of Kama'aina who are going to be coming back to try to beat this deadline before they have to quarantine?
Right, so the question is two parts. What about visitors who are currently here? And what about Kama'aina who are returning home? And are they going to try to have to beat the deadline?
Right. Well, certainly we would be encouraging people who are here to end their vacations. They would not be subject to quarantine. Only those travelers who arrive in the islands after the start of the quarantine would be subject to quarantine. Residents who arrive in the islands after the start would be subject to quarantine, self-quarantine at home.
So would the state be able to handle the possible influx?
Certainly, they're already coming back, right? I mean, one of the reasons we did delay it is so that people who are on the mainland and want to get back, they will be able to get back to the islands. I think that all the airlines recognize that this order and mandate will impact travel to the islands. They are all working to make the appropriate adjustments, accommodate those who have reservations, and making changes depending on whether they would want to delay or come in earlier. And we continue to work with the industry so that we can continue to recognize that Hawaii is a special place. We want to treat our residents appropriately, but I think I am most proud because everyone understands that they have a responsibility in this fight against COVID-19. And everyone has been willing to take on that responsibility.
This one is for Peter Ingram.
For Peter Ingram?
So was there a Hawaiian Airlines flight attendant who tested positive?
The question for those who didn't hear, was there a Hawaiian airline flight attendant who tested positive?
To my knowledge, we've had one employee who has tested positive for the disease. This one case was not related to any of the travelers who have We've had 3 travelers who were later tested positive after having traveled on our flight. All of the flight attendants and pilots associated with those flights were given time away from work with pay to self-monitor, and none of those individuals or the airport agents associated with that have come down with the disease.
I mean, since this is a virus that is obviously related to travel, and flight attendants travel probably more than most people, why would they then not be quarantined, or these same guidelines adhere to them?
So, thank you,
Is that
Sarah.
for me or the governor?
No, that's actually I'm gonna direct that to Director Hara. The question is, I think that the question is about flight attendants and how they're going to be treated, because they fly a lot. Aren't they at risk? And I think that your order addresses that.
Okay, so for the flight attendants and the crew, the flight crews, right, all of them, those that remain in the airport, that don't leave the airport, will be able to roam free and won't be subject to any of the constraints. Those that leave the airport will be subjected to a temperature check, and if they test beyond a certain, temperature, then they'll be forced to isolate. And the others that normally, because they stay such a short duration, that in working with the flight industry, we thought it was best to accept that marginal risk, 1 to 2 days staying in Hawaii, and then they get back on their plane and fly out. So it would really disrupt the airlines if all of their flight crews eventually got quarantined for 14 days. Those that do not want to take the temperature check, that's on them, but if they don't take the temperature check, they'll be subjected to the 14 days quarantine.
Peter was going to address that as well.
A couple of things I just wanted to add. One, I'm not aware of any cases of transmission on a Hawaiian Airlines flight. The one employee I mentioned earlier was believed to have caught the disease outside of Hawaii, and we have added and enhanced our procedures that were already in place around hygiene and care on our airplanes since this crisis began. We've always supplied our airplanes with gloves and masks to be used if necessary. We've now allowed our flight attendants in particular, who are interacting with guests all the time, to wear those throughout the service. And we've really, upped our standards and really taken care to reinforce our cleaning protocols to make sure that flying on our airplanes is safe.
Marcel, I'm going to do KITV. We're going to do KITV next. Then I have a PBN question, and then we'll go to Civil B. So please.
This is for Governor.
Okay.
Governor, what is the process for applying for one of the exemptions that you have?
What would be the process for applying for an exemption?
Okay, it's actually for me. So we're going to be putting out guidance, but right now what we're looking at is setting up a website and a phone call with our Joint Information Center, and then they'll get all of those requests up to me, and then I'll make the determination. So generally, the criteria right now I'm looking at is anyone that's coming into the state for COVID-19 response to assist the state, anyone that supports our critical infrastructure, key resources, and any essential services. So, like for the COVID response would be our first responders as an example. But I couldn't think of every single caveat, right? So that's why I need to establish this ability for them to submit a request.
Marcel?
Also, for General Hara, wondering if the airports are still moving towards screening passengers in general, like you guys had mentioned that in earlier press conference.
Right. So yeah, we're still in the planning phases for that. Yes, but we believe if everyone is going to be in a quarantine. Oh, sorry. So you're asking if we're going to do the screening, medical screening at the airports. So the answer is, because we're doing the self-quarantine now, we really don't need it, right? Because everyone's going into quarantine. But we are still moving forward with a plan, should we lift the 14-day quarantine, to have the ability to set up medical screening at the airports.
The next question is from PBN, and the question is to the hotel industry. Can you tell us which hotels are closing?
Obviously, from the very beginning, our hotels have taken this very seriously because our employees are most important to us. So every option has been on the table to keep them gainfully employed, whether it's reducing the hours, furloughs, and the like. In terms of closures, I'm not at liberty to say at this point which hotel is going to go down that road, but it wouldn't surprise me to see that happen because these are very dire times. So we're going to try to remain open as we can, but recognizing that less and less visitors coming here because of the actions that we're taking is what we are contemplating.
Marcel, we're going to mention. Marcel?
For the governor?
Okay.
In advance of this taking effect, do you recommend that passengers that are arriving before Thursday voluntarily quarantine themselves in the manner in your ordinance?
So the question is, passengers arriving before the deadline on Thursday morning at 12:01 a.m., would they be asked to voluntarily quarantine? Thank you.
You know, actually, we're hoping that when they understand what the quarantine means, they would decide to reschedule their vacation and come after this critical period. Certainly, the quarantine would require them to stay in their rooms, period, and not leave their rooms for the entire quarantine period. So, you know, we are working. We do recognize that we don't want travelers in our community at this point in time. We would want to be able to deal with the COVID-19 virus. We don't want travelers to come in and take resources away from our community. We have a limited bed capacity within our healthcare system here in the islands. So the real focus of the mandatory quarantine is to discourage travelers from coming to the islands until after this crisis is over.
Jen?
Never mind.
Anyone else? Ben?
Quick question for Governor
Okay.
Ige. These are tough times for the industry, for just about every industry, but was there any pressure to continue keeping visitors coming into the islands from the hotel or the visitor industry? And what may have changed since the last time we saw you on Tuesday to institute this travel quarantine?
So the question is basically, how is the governor working with the travel industry? What kind of pressure was there? And, sorry, did I get that right? More or less? What changed since Tuesday?
There was really no pressure. I mean, I do think that everyone here in the islands recognizes that what is happening has never ever happened before. I mean, clearly, I am proud of the industry for really stepping forward. Yeah, obviously, first and foremost, their employees are top of mind, and I really appreciate everything that they are doing to ensure that the employees can continue to receive benefits, even recognizing that this mandatory quarantine will dramatically reduce the revenue that each of them are receiving. So, I think it's a testament to Hawaii once again. The recognition that our community is more important than the individual entities involved, and that we can come together in crisis to make the important decisions, the tough decisions that are focused on what is in the best interest of our community.
Now, Mufi's going to add to that.
I just want to say on behalf of the hospitality industry, when it comes to public health and safety, there was no pressure placed on the governor to delay whatever decision that he had to make. We recognize that's what's most important. So that's why we're here today, to cooperate and do all we can to ensure that we can get out this sooner rather than later.
We have a question from PBN for Elliot to talk about the decision to close Aulani.
Sure. We made the decision to close Aulani effective Tuesday the 24th, primarily, again, for the safety and welfare of our cast as well as our guests. We really value our guests. We really appreciate them coming. We're taking great care to make sure that they get home safe over the course of the next few days. We're also calling and getting in touch on everybody who is planning to come to Hawaii to make sure that they can hopefully rebook at a later date. But primarily we want to take care of our cast, take care of our community, and make sure that we get out of this as soon as we possible by containing this virus as quickly as possible to get our industry back up in good, healthy shape again. Thank you.
And Elliot, are there plans for layoffs and furloughs within your company right now?
So
And any estimate as to how many?
The question is, are there plans for layoffs or furloughs, and if so, how many?
So currently, right now, we're still operating. We have a healthy amount of folks within the hotel, and we're putting together a plan for closure that's forthcoming, and we'll be sharing that with our cast shortly.
Who else? That would also be Peter. Peter.
Sorry, I didn't hear the question.
Are there any plans for layoffs or furloughs at Hawaiian Airlines?
We have not furloughed anyone. We are doing everything we can to avoid furloughs. Obviously, the last several weeks have been incredibly difficult for our business. We are losing millions of dollars. Our revenue has gone to virtually zero, and some days our bookings are negative. We have more cancellations than refunds. So it's an extremely difficult time for our business. We've offered voluntary leaves to our employees, which have a variety of attributes to them, including continuing health care benefits. And we're trying desperately to avoid involuntary furloughs. But I can't predict what the future will hold, unfortunately. I wish I could have more confidence that we'd be able to avoid that in the long term, but this is a very uncertain situation.
Jen, and then Jen.
What is being done so that international travelers from Japan or China understand what's going on?
What's being done for international travelers who may not understand what's going on? Sorry, hold on for a second. Eric, so we have a new resource here. Hold on for just a second. Eric, the question is,
Aloha, Eric Takahata with Hawaii Tourism Japan. As far as Japan goes, we are communicating with, first of all, the Japanese government and all the media outlets in Japan to get proper information to them as quick as possible. And, of course, we work for the Hawaii Tourism Authority, so we follow HTA's lead, and our messaging is pretty consistent and across all global markets. So for Japan, that's kind of the plan of how we get the information out.
I just wanted to add that we have been in communications with the consulate generals from especially those markets where we have significant travel. And so we will be informing them of the order and the requirement for mandatory self-quarantine. So we will share that information with the consulates and certainly request their assistance in informing appropriately the businesses that would be most impacted.
how many beds and ventilators? I'm not sure that we can answer that, but we'll...
I don't have that. I do have an inventory. I can get that information to you.
Governor, just to clarify, you had said in your earlier remarks that there's no evidence of the virus in the broader community. However, there have been cases, I think, that were finally attributed to community spread. Could you maybe kind of clarify the distinction there?
No, I mean, I do think that when we evaluated all of the cases, it was connected to travel, all except one that is still under investigation. So 47 of the 48 confirmed COVID positives have been traced back to travel-related infection. And Bruce, I don't know if you want to add any more specific, but that's the information we have.
We're reporting these cases as they occur, and often we report them within hours of the time we find out about them. One of the cases we reported yesterday that we thought had no travel history actually had a visitor living with him who came from Europe. So that obviously was one of the exposures of concern. And we're still investigating one or two of these others today. But so far as we know, they all have exposure to a traveler or have been traveling in places where COVID-19 is. What we're concerned about with this sustained community transmission is a situation where we have more than one case, where we have a number of cases where we can't trace the source to a traveler or to some other place. Then the virus is circulating in the community, which is occurring all over the country, but not here right now. The Sentinel surveys that the governor mentioned are our best indication of what's happening in the communities. Those are random samples of people who have respiratory disease. It's not the flu. So they're highly likely to have this disease if they have it. So we're pretty confident it's not widespread today. And of course we want to keep it that way. That's one of the reasons why this ban isn't, or the quarantine's being considered. The cases are bringing in the virus. They're importing the virus to Hawaii, and we want to put that to a stop.
Mr. Governor, and this is how, besides this forum, will travelers or potential travelers know not to come, that this quarantine is going into effect so that they don't arrive on Thursday and suddenly be surprised that they're going to be in quarantine?
So the question is, how are passengers and people who are planning to visit the state, how are they going to know that this is in place and so they're not surprised when they get to the airport?
And certainly that's why I think it's very important for you to see the industry support that we have. Every property is going to look at the reservation made and make contact, inform them that this quarantine has been ordered and what the impact of that would be. We're working with the airlines once again to do the same thing. We will give them a copy of the quarantine orders. They will understand what mandatory quarantine means, and they can express that to their customers and certainly encourage them to reschedule their vacations to a time where we would welcome them to be here.
Up to this point, because airline travel has decreased so much, many of the airlines have significantly lowered their prices, which has attracted a lot of people to come here, even though they shouldn't have. So why are airlines lowering those prices so much, making it,
So the question is, what about the airlines that are running discounts in order to fill the seats to come to Hawaii right now?
This is the first time I've ever been asked about our prices being too low, I think. That's unusual. So, our prices are set competitively in the marketplace. Each airline sets their own prices, and typically airlines respond. The low prices you've seen from the U.S. mainland in particular weren't initiated by our airline, but if we're to sell tickets to people who do want to travel, we have to make sure that we have prices that are competitive.
Were 500 employees asked to voluntarily furlough at Hawaiian?
Pardon me?
Were there 500 employees asked to voluntarily furlough at Hawaiian Airlines?
We are offering voluntary leave options to employees in a variety of work groups. So virtually all of our employees will have opportunities to volunteer, and I stress the word voluntary. They will have opportunities to volunteer to take leaves if they would like, if that's attractive to them at this time. We have not involuntary furloughed anyone at our company, and we're trying desperately not to do that.
This is for Governor Ige or General Hara. What about returning members of the military? How are they impacted by this order?
The question is about, what about members of the military returning to Hawaii? Perhaps Director Hara can take that.
The military actually took similar measures for the entire Department of Defense, I think over a week ago. So they already started this quarantine. There's a huge restriction on military travel. It's like at the multi-star level for any travel within the Department of Defense.
Okay. It's actually for General Hara. And it's basically dealing with how are you going to handle this? Because right now there are already people that are being self-quarantined. Once this kicks in on the 26th, that means 14 days is April 9th, I believe. there's going to be so many days and people to keep track of. I mean, realistically, who is going to be keeping track of each individual that may come in?
So the question is about who's keeping track of each individual who's coming in, especially since their days, the 14 days of quarantine would be different for everybody coming in.
Yeah, that's going to be extremely challenging. Well, one thing we're going to do is the passengers arrive, we're going to date stamp their form, the agriculture form, and that's probably the best way we can track it. But to be honest, you know, we're thinking it's going to be very difficult to enforce this.
Okay, so the question is for Dr. Anderson from the Department of Health to clarify testing procedures here in Hawaii.
Our procedures in Hawaii are basically what's being recommended across the country, and that is if you're symptomatic, you should be tested. That's it. People who go to the doctor and are worried that they might have been exposed and are asymptomatic should not be tested. We have a shortage of supplies as it is. Some of the hospitals have 18 days or less of masks or eye protection and some of the other critical gear. We don't want to spend a lot of time and resources testing the worried well. We need to save that for the people who really need to be tested. So if you are symptomatic, we definitely recommend you contact your healthcare provider and they can make arrangements to have you tested. And that's the way it should work. You still, yes, here in Hawaii, you still need a doctor's referral to be tested. And that, we expect that to continue. That's critical. The doctor can evaluate your condition and determine whether you need to be tested or not. And most physicians here are being very responsible about doing that. Thank you.
We're needing to take just a couple more questions, and it's especially if they're specifically related to the quarantine. So, Tim, did you have a question? Oh, can we take it offline then? Okay, any other quarantines? Okay, Ben, you have one more.
This would be for Adrian. I know we talked about the airline prices and those being low and being a draw for people. We checked on the website, and a one-way flight from Boston is $188 from Hawaiian Airlines right now, $139 from San Francisco for Wednesday. And so would that still possibly bring people in who would otherwise, or, you know, I mean, what's the explanation as to why they're so low right before they?
Yeah, so the question is, airlines right now with rates prior to that Thursday cutoff time.
So the schedule that has been loaded was based on the expectation that there was flying before. We haven't drawn down our schedule in anticipation of this announcement. We didn't want to front run the governor's announcement today. I suspect that as people hear the news, we're going to see very, very little traffic on our flights. That's why we're drawing down our schedule in the days ahead, and I think you'll see that wind down over a few days and then very quickly come to almost no service at all. But, you know, within roughly a week, and we're still finalizing the plans. It takes us some time to get those new schedules out. But the load factors are very low. We're very low already. I expect that we're going to see very, very limited traffic on any airline over the next month to Hawaii.
Thank you, everybody. Just want to note two things. Number one, I think there's been some widespread belief that it's all about the visitors, but if you look at the testing results, the majority of them have been returning Hawaii residents. So I just wanted to make that clear. If I'm not mistaken, I believe it's 80% of the cases have been returning Hawaii residents. Finally, I just wanted to let you know this is a rapidly changing situation. We will be updating you as soon as we have new information. We will let you know. We will provide that information to the public in order to keep everyone here in Hawaii safe and healthy, whether they're visitors or our guests. Mahalo.